This is known as the digital age. So we're slowly steering away, I guess, not fully away, but a little bit farther from traditional medicine, going into a more advanced technology. And use of artificial intelligence is heavy nowadays. And I think that, well, I am convinced that there will be a more presence of AI in healthcare delivery, especially in neurology. We are in our center, we are already using a form of AI just in telehealth, telemedicine. We have ambient listening, which decreases the burden of documentation. So basically picks up the conversation of the patient and provider. So we don't have to document, and that's very helpful. There are centers now that are using deep learning techniques, which is AI, to get the pathology of the brain tumor intraoperatively, and that's usually in that will save a lot of time in order for them to start treatment in the hospital if necessary. I think that there's a vast use of AI in neuroimaging, especially in our center. We use AI also in recognizing neurocognitive disorders that possibly has an etiology of from neurodegenerative disease. In movement disorders, there is this new type of deep brain stimulation. This is actually a surgery that we use for movement disorders, but mostly for Parkinson's disease. It is not new, but there is a newer type where we call it adaptive deep brain stimulation, basically getting the signals. There are electrodes planted in the brain, and they get real-time signals of the brain that correlates with the motor symptoms of Parkinson's disease. So the new thing about it is that it's closed loop. So they get the information, they can actually change the settings to improve the symptoms right away for the patients. We used to make them come back to the clinic and then look at all the data and then do the changes. But with this new tool that they have made, it's easy, and it is hopefully very helpful. This is not approved yet in the US. We are hoping to see this hopefully this year. It's been just been approved in Europe. There are very exciting innovative devices that they're bringing up. For example, this footwear that they are targeting for freezing of gait. Freezing of gait is mainly a symptom in Parkinson's disease where the feet get stuck on the floor and it's difficult for them to initiate walking, and it's very problematic. There are times the medications won't help that. So the wearables, they are inventing footwear to help with that. There are also the watches that is now covered by Medicare to help improve symptoms of tremors, mainly for essential tremors patients. As far as new treatments, they actually just sent to us in our center. We are hoping to see this new infusion of medications, mainly for Parkinson's disease. So, because the medications can be affected by how you absorb them. So a lot of times you get the fluctuations. Sometimes they don't work at all. So now there are two infusions mainly to address those fluctuations. So we're hoping to see more of that this year. I am optimistic, and I'm praying and I'm hoping that we find a cure for Parkinson's disease. This is a second most prevalent neurodegenerative disorders worldwide. It is estimated we have about 900,000 individuals diagnosed every year, and that's going up. So we have to steer away from that, where the Parkinson's disease is prevalent. We should have a world where it's rare. We're hoping to find a cure. I hope that it's almost there, and we're hoping that the other atypical Parkinsonian syndromes also get to that.